Church of Cannabis. Follow elevationist.org. And for more info on the Psychedelic Club, follow us via Facebook or Meetup. And all these great organizations can always use your volunteer time and money. So without further ado, let's get Dr. Ross.
Well, first of all, I want to say thank you to the Psychedelic Club for giving me this opportunity to speak. Most of you know me from the cannabis space, and while I do get to talk across the country about psychedelics, my experiences with them, the research behind them and where we need to go, those opportunities have been a lot less than my opportunities to speak about cannabis. But it's something that I am just as passionate about. And what better place to do it than in this most beautiful, beautiful setting. I mean, the Church of Cannabis is just gorgeous. It's awe-inspiring. And this is really where communities should be. This is where our communities are going to be building the future of a better world. So I'm so excited to be here. I'm tickled. So thank you so much for showing up on a Monday evening. And I hope that you get a lot from my talk. Unfortunately, since psychedelics, most of them are Schedule I drugs. I won't be giving specific advice on dosages, where to buy, say, psychedelic drugs or anything like that. Those conversations really should be in the care of a professional in a private setting. So I will be answering Q&As after the talk, but definitely most of those kind of conversations are very much personalized medicine, personalized experiences, and should be done one-on-one. So again, disclaimer, FDA has not evaluated most of these statements, nor do they usually care to. And I will not sell or give you drugs. So please, sorry about that. I wish I could, but we'll have to wait till we legalize psilocybin for that, right? Okay, so I am a PhD neuroscientist. I actually spent my doctorate thesis studying all sorts of different types of drugs. I spent many years actually hooking rats up to little operant boxes where they got IV drugs, everything from heroin, cannabinoids, and I'm sorry about that. I'm just going to stop touching that. So cannabinoids, cocaine, methamphetamines, ecstasy, so many different types of drugs. And I worked for the government, and the government loves to fund research that drugs are bad. And so my job was really to find out how all these substances of abuse were harming the brain, and specifically brain development. Some of the work that I did was actually very interesting. I actually was really hardcore anti-drug scientist. I grew up in front of a crack dealer, basically, in New Jersey. So I grew up thinking drugs are horrible. Some of those drugs had a horrible impact to my community, to some of my friends, and I really wanted to help the world by ending all drug addiction and making sure all drugs were illegal. And it's very interesting how I got from there to here. So I'll tell you a little bit about that story. So actually, one of my very first papers was on the endocannabinoid system and how it could possibly grow brain cells. And that was like the first time that I actually thought, hey, maybe what they're teaching me in school isn't right, and we should start exploring some of the possibilities that some drugs may actually have beneficial effects. CBD in particular boosts adult neurogenesis, which is new brain cell growth, in areas like your hippocampus, which is important for learning and memory, mood. It's actually possibly how antidepressants like Prozac work, is by boosting those new brain cells. So there's some really exciting work there. A lot of psychedelic drugs actually boost adult neurogenesis. And so we're finding that these drugs that are Schedule I and evil are actually having medical benefits, and we haven't really explored them just because the research funding isn't there for those medical benefit studies. And as I'll talk about a little bit later, a lot of private funding, thank goodness, from the work of MAPS and many other groups, has funded research that the government doesn't want us to do, because psychedelics have amazing properties. They can open us up. They can make us aware of the life that we're living may not be the best path for us or for society. And you know, government is about control, so I'm not here to be like an anarchist, but it was very different as I went on this journey to exploring psychedelics, how I went from a really, really staunch anti-drug scientist to someone that not only embraces drugs for personal, medical, and recreational use, but also somebody who strongly believes that all drugs should be decriminalized, that the war on drugs is no good and we have to stop that. So I'm gonna move this right here. So I'm really excited actually to be going to Portugal in March to learn about how a country has decriminalized all drugs. I work with Drug Policy Alliance, who also has that same stance, so I'm really excited about that. I hope I can report some of those things. I mean, imagine a world where we're not sending people to jail simply for possessing substances of abuse. Again, we call those substances of abuse, I call them substances of exploration. So, I ended up at Caltech and after my PhD, and then I did a really weird pivot for a scientist. I ended up going on reality television. I was actually the first scientist ever on reality television. I did Big Brother, and it was during that point where you're locked up in a house for 3 months and you get to think all about life, where I decided that chopping off rat heads off of living rats wasn't my life path. That was not going to bring me joy, and in fact, I felt a lot of shame over all the animals that I killed, because even though I was doing, great, fantastic academic work, it didn't translate into actually helping anyone. So I ended up a little bit lost after that. I didn't really know what my path was. I'm in Hollywood, and I wasn't really sure what the next step was. What was interesting was I'm also in California, which is a hotbed of psychedelic use, and I ended up using DMT for the first time, which I had a really, really interesting experiences with that, and some of those experiences actually told me to step up and really start educating people about cannabis, that I had this gift to be able to educate people and rally them up for change, which was, I'm a timid little scientist, so that was really weird to keep hearing that message over and over again. Maybe I can just take this off. Does it come on? There we go. I think that's much better. Okay, so I didn't actually become sort of well known by the psychedelic community. It happened by accident. Amber Lyon of Reset.me actually invited me for an interview about psychedelics, and it was really the first time I had ever talked on camera about psychedelic experiences, and I talked about my DMT experience in particular, and it was sort of crazy because as a scientist, you have all these words, you know how to explain really complex activities in the brain, but to explain a spiritual, life-changing, mind-blowing psychedelic experience, I mean, it's like trying to encapsulate how beautiful this church is. I mean, it's just, sometimes you don't have the words for it, and I still am so grateful for those experiences, and I kept learning, kept exploring other psychedelics, and it really led me to the path where I am today. So in 2013, I founded a cannabis nonprofit to do clinical research, education, and advocacy. Back in the day, it was called the Endocannabinoid Deficiency Foundation. Now it's called Impact Network. We further focused our mission on helping women and basically making sure that clinical research happens on groups that are most underserved by our current medical system. Women are less likely to be diagnosed for illnesses. They're less likely to be treated with the proper dosages of medications. They're less likely to have legal resources when they get in trouble, say for being THC positive if they're a pregnant mom, or if they're in a custody battle. So we have a lot of work to do, even though we've legalized cannabis across both Colorado and almost half the United States. There's still so much we can do. I actually, last year, founded the first app for connecting women that use medical cannabis with experienced users so that we can peer mentor people and help them along that journey. Because as we all know, any psychedelic, even some of the lighter ones like cannabis, it always helps to have a guide and a helping hand through that journey, because it's confusing as hell for a lot of people, especially because our laws are different in every city and every state. I've had the opportunity to speak at some really cool talks, for example, in 2016, I keynoted the Telluride Mushroom Festival, which was an amazing experience. Those people, oh my God, that festival has happened for so long, and it was just amazing to learn. And like, as a scientist, I'm still learning every single day. I'm definitely by no means a psychedelic guru or anything like that. I'm very young in my career, but learning every single day from both experts and just people that have gone on that experience. So that was something that was really eye-opening for me. I actually presented at the conference. I'm like, there's all these amazing mushroom experts here, not just magic mushrooms, but regular mushroom experts. And I'm like, why don't we apply what we've learned about cannabis legalization and start planting the seeds about psilocybin legalization? And the audience there was like, what? Like, they couldn't even grasp that, like, this could happen, you know, not 10 years from now, not 20 years from now. We can apply what we know about cannabis legalization and start fighting for psilocybin legalization, start fighting for other psychedelics. So that was cool to plant those seeds, and now we're starting to see many different initiatives pop up, and I'm just so thrilled. So the journey is working, we're educating, and we're changing minds, and we're evolving. So it's pretty cool. I published a book, it's coming out on February 23rd, it's called Vitamin Weed. And then finally, realizing that cannabis coaching and psychedelic coaching really is like an uncharted no man's land. We don't really have regulations. Not everyone is getting the right coaching. There's people that are sometimes spending all this money on new products or coaching or education, and they're coming up either still confused or armed with the wrong information. So it was really important to work with the best people in this country and across the world and really come out with protocols and ways to help people with all the tools in the toolbox, not just cannabis, with mushrooms, with LSD, with whatever people have access to. And again, we don't know where they get these products from, but if they have them, we can help them use them to help themselves. Okay, so there are many, many different types of psychedelic drugs. They all work in very different ways. Some work on cannabinoid receptors. Most of them work on the serotonin system. So if I went into how these drugs work for each of these drugs, we'd be here all night. I do say that is a really exciting time where we can start exploring all the medical applications of these different psychedelic drugs. It's just simply amazing. What's even more interesting is that a lot of people think that psychedelic drugs users are some, kind of minority of our population. And in fact, I think the most recent data was in 2010, but 32 million Americans have actually used some form of psychedelic drug. So it's definitely something that people have experience with, whether or not they'll tell you about it. 20% of Americans in sort of my age range have used them. So that means that we have a lot of people whose eyes are open. And so some of them may have had a good experience, some of them may have a bad experience. What we need to understand is how to mediate that so that people have good experiences and they support legalization of efforts like the psilocybin initiatives. We still don't know so much about psychedelic use. We don't know what the risks are. We don't know what the benefits are. People use all sorts of doses. There's people that have done, a lot of LSD for, say, a month or two. They've survived, but is that healthy? Is that good? There are some people that have done really high doses in one day and have had wonderful experiences. But we still need to understand really what the long-term effects, short-term effects are, if there are any, say, drug interactions, because people tend to use psychedelics, not just always by themselves, sometimes they use them in conjunction, and right now too, there's also people using CBD with other psychedelics, and CBD can actually inhibit some liver enzymes that break down drugs, and so that's just an interesting thing to think of as we talk about, making it as safe as possible for people to explore psychedelic drugs, both for spiritual and emotional health, but also for medical benefits. And unfortunately, little research has been done. I mean, most of these drugs are Schedule I drugs, and you may have heard from me, you may have heard from other people like Sue Cicely, like they're is a lot of hurdles to doing Schedule I research in the United States. Thankfully, psychedelics, it's a little bit easier because the government source of psychedelics like psilocybin aren't, say, tainted. The product quality isn't as bad as, say, cannabis, which is useless, and most researchers that have used the cannabis that comes from the federal government would never do it again. And we're restricted usually from using cannabis that comes from states. Like, for example, it's still really hard to do a federally approved study with, say, cannabis from Colorado. Like, that's illegal. They won't approve that. So we have a lot of questions still with psychedelics, so many questions. So it's really important that we all do our part in trying to answer some of those so that we can convince other people, especially the public that has never tried psychedelics, that these drugs are in fact safe, that they may be safer than most of the drugs people use, like alcohol, and to let people choose what they put in their body. So what's really fascinating about psychedelics, besides the ability to help with emotional healing, there's real evidence for helping many mental health conditions. For example, anxiety. I mean, all of us have anxiety. I think it's getting worse in this Trump era, right? But we're all anxious. We don't know what's going to happen tomorrow. We live in this little chaotic world. We have job stress, road rage, everything. I mean, most of us are anxious or depressed. 350 million people worldwide have depression. Many of them have treatment-resistant depression. Many of them don't seek doctor help with their depression. They just sort of slug it along, and almost like like a functioning alcoholic does. I mean, being a functioning person with depression is really hard. You know, you're not living your best life. We have veterans and other patients with PTSD, and we know that cannabis and other psychedelics can help with PTSD. And yet, you know, we're still waiting on these drugs to be legalized. Addiction. We all know somebody who struggles with alcohol or substance abuse, right? And if there is a way to help somebody that was struggling so that they don't die, I mean, we have a huge opioid epidemic in this country, and yet we're not using all the tools in our toolbox to help people. It's just maddening. And so the more research we have on whether legalizing additional psychedelics or even cannabis, right? We know that several studies have shown that when you legalize cannabis in a state, you have less DUIs, you have less opioid overdoses. I'm sure that we'll find that if we legalize additional substances that can help with addiction, that we'll also see less overdoses. And migraine headache is an interesting one because a lot of us deal with it, and it's not a simple thing, right? Like, some people are like, oh, it's just headaches. There's people that are completely disabled and can't work, can't take care of their families, and it's just migraine headache. And yet most of the medications that are out there just don't work. I'll go into that in a little bit. And I just wanted to be a little bit current of the moment. I don't know if you guys have been watching, but there's been a huge women's empowerment movement. There's been a lot of social media, TV time, blog coverage, new coverage about the Me Too movement, which is women speaking out about being sexually assaulted or discriminated against or hurt, and literally every single woman is Me Too. So we have this outpouring of pain and trauma, outpouring. And it's great to say, you know, it happened to me, you know, it happened to me, it happened to you, it happened to everyone. If you're a woman, it happened to you. But what are we doing about it? Are we helping people get therapy? Are we helping, you know, we're just talking about it on social media, but we're not making concrete steps to heal women so that they can live their most productive lives. And one of the ways that we can heal women is through psychedelics. It can help with pain and trauma of sexual assault, sexual harassment, discrimination, just years of baggage from, unfortunately, dealing with the crap that happens when you're a woman. And what's really cool is that there's been anecdotal and clinical evidence that different psychedelics, especially in conjunction with a therapist, could actually unload some of that baggage and help people deal and heal in a day rather than going to a therapist, say, for years and not really making any progress. And the most important part of that is that so many women can't engage in therapy for their issues. It's expensive. How many healthcare insurance plans, especially for low-income women, cover that? You know, they might cover, a couple sessions and then you're done. Your healing isn't there yet. You also have to deal with childcare, right? You can go to therapy, but who's going to take care of or watch your kids? And so the, couple times of therapy plus psychedelics is really appealing to helping women overcome their trauma, and I'm really looking forward to that being employed and being accepted by so many people. I think that this option most people don't know about, and we really need to turn the conversation from not just I have a problem to this is how we solve our problems. So back to migraine headache. So this is an interesting one because psychedelics are so useful for this, and because migraine headache is a problem that causes millions and millions of dollars of lost productivity for the United States. And so it's sort of interesting when you're talking to people that don't understand psychedelics, right, or don't, say, support use of recreational psychedelics. Talking about psychedelics for migraine headache is a great entryway to make them reframe what these substances are about and what their potential is. Again, millions of patients suffer with this. Cannabis is known to actually help migraine headache. It works in numerous ways. A couple of them is that it can actually reduce serotonin release from blood platelets, which is one of the mechanisms for migraine. CBD can improve anandamide levels, and that also inhibits serotonin receptors associated with migraine. And you can reduce inflammation and pain. We're finding new strains, new cannabinoids, and how they help with migraine, different routes of administration, but there's a lot to play with there. And it really is better than the alternatives. Right now, people are told to take OTC drugs, which if you talk to a severe chronic migraine patient, they're going to tell you aspirin doesn't work. They've gone through a laundry list of every single drug that's available to them, and there's lots of these drugs. Unfortunately, some of these drugs cause the same symptoms that they're trying to treat. For example, when you have migraine, you have nausea and vomiting, and some of these drugs cause nausea and vomiting. So that's the prescription medication world. And in fact, some of the ways that they try to get around this is by making suppositories so that you're not swallowing these pills or things like that. But if a patient goes through all these different drugs and there's still nothing for them, making the alternatives, whether they're LSD, whether they're psilocybin, whether it's cannabis, not available to them, should be criminal. We know that they work. And so we have to do better and give people their life back. There's also another form of headache that's very different from migraine headache, but cluster headaches is something that's also being explored with psychedelics. And again, these are disabling conditions that cause people to kill themselves. So we have to really, with the same urgency that we talk about saving veterans that are killing themselves from suicide, from PTSD, we really have to talk about people with chronic illnesses, the pain and disability that they suffer every day, and offer the same solutions to these patients. So psychedelics are safe for migraine. CBD and cannabis can be consumed in different ways. You can use topicals applied at the back of the neck or the temples, and that is actually a way that those cannabinoids aren't taken up into your bloodstream, but they do relieve migraine headache. And in fact, if you take them daily, it can even prevent the induction of headache. So that's amazing, right? If you could take something and it doesn't get you high, and you can go on with your workday, and it's a great substitute for the possibly ineffective medications you were taking before. Again, a lot less side effects. No one's ever died from cannabis or CBD, right? It can treat more than one symptom, and you can microdose too. If you end up choosing, say, to eat CBD or cannabis, like, you're not going to really have any psychoactivity. So that is a concern for people that aren't psychedelic explorers. Grandma, for example. It's nice to have that. We have to understand that some of us want to feel, mind expansive properties of psychedelics, and some of us don't. Psilocybin, so microdosing is one way that you can treat migraine, and some patients actually, once they're treated, don't need to take psilocybin, possibly for months afterwards. And so there's very few drugs on the market where you take it a couple times and you never need to take it again. And so that shows the power of these drugs to rewire the brain. Whereas all these other pharmaceuticals, they're merely just masking the symptoms. They're not treating the root of the problem. And that's why you have to take one drug, and then another drug, and another drug, until your brain chemistry is actually all messed up. So it's really cool. We don't quite understand how all these psychedelics work to alleviate migraine pain or other conditions, but I'm sure that once we can legalize some of these substances and research them more, that we're going to start to find out how they work. LSD is the same. There are patients that have reported using microdoses of LSD and making their migraines that, again, were treatment resistant for everything else go away. So the other interesting thing is, how do we know what kind of patient is going to benefit from psilocybin versus LSD versus cannabis versus a pharmaceutical drug, right? I'm sure there's genetic influences of why one psychedelic might work better than another, and we still have so much research to do to identify. Wouldn't it be cool if you could go in the doctor's office and they go look at your genetic history and they're like, you need psilocybin? You know, that's the future, and it's really cool. Imagine if you just didn't have to suffer for 10 years trying to figure out what is the perfect drug for you. We're still there. So, give it 5 years. Okay, so despite knowing that psychedelics can help with so many different medical and mental health conditions, we still don't know exactly where to go for help. And there's issues like our doctors are really not educated on this. Is our doctor going to report us for being an illegal drug user, right? We all have that lovely drug questionnaire where they go and, even if you're in the hospital, I was just asked, I went in for like a kidney infection, unfortunately, and they're like, what kind of illegal drugs do you use? And I'm like, do I answer? No, don't answer. Even though it's cannabis, like even cannabis, they'll report you as like an illegal drug user in this state. So you have to be careful. But in terms of who we can talk to, there are amazing experts, both in the academic and healthcare professional world, as well as unexpected sources, your friends, your coworkers, who knows, even your mom. Oh. There's lots of unexpected sources of help, and I'm going to help you identify how credible those sources are, what we can do with that, and where we're going to go. So there are 4 types of psychedelic coaching. So we have self-coaching, community coaching, one-on-one coaching with, say, an unlicensed therapist or a nutritionist or some other expert that's, not quite got the all the degrees that, say, a licensed therapist has. And then the final form is the one-on-one coaching with a licensed therapist, which is pretty much all the MAP studies. Okay, so self-coaching. This by far is the easiest and least expensive way to explore psychedelics. And it's really just recording your experiences, right? It can be as simple as taking a diary, taking a journal. For cannabis, it's been really interesting because there's been a lot of journals that have opened up. On the left, I put one down for Gold Leaf. They actually make a great journal if you're new to cannabis, or if you know somebody that wants to explore cannabis. You can write down what strains work, how it made you feel. For older populations, they like that because, like, working on a little app, it can be really hard, say for grandma, or someone you're taking care of. So to just be able to write in is great, and then you might be able to take it to your healthcare provider, or say somebody that doesn't believe in cannabis, or a cannabis coach. So that's a nice option. And then we have the apps. Impact Network actually works with a company called Strain Print. There are the software partner that's actually going to host our registries so that we can go data mine for our women's health and cannabis information. And what's interesting about this, so for example, like there are many other apps besides Strain Print, so I'll focus on this one, but there's a lot of different ones. There's like Medicate Me, there's a bunch of ones. They all have different reasons why you use them, right? But the main premise is that you have a symptom, like, okay, I feel super depressed. Okay, let's rate how depressed I feel on a scale of 1 to 10. And you put that in there. Then you tell, say, an app, okay, what am I going to use to get out of this depression? Okay, plug that in there. Okay, I'm going to smoke a strain, or I'm going to eat, say, a CBD pill or something. And then you plug that in there, and then it waits a certain amount of time, and then it gives you a little alert, and it says, hey, did you feel better? And you can keep doing that, and by yourself, sort of optimize your treatment plan. This is only available so far in cannabis. We don't really have apps, say, for psychedelic journaling yet, besides just filling out, say, Google Forms or your own diary and submitting. And part of that is due to the Schedule I nature. I would love to be able to use platforms like this to plug in and just say openly, okay, I'm using 0.5 grams of this substance, and this is how it helped me. But there's a lot of, say, legal risk already with cannabis. So it's harder to convince companies to really go through that extra step and start adding other, like potentially more illegal to them substances. So all these platforms are really cool because you can coach, you can, self-document, but you can also do research on these platforms. And as a researcher, it excites me when I see something that we can work with. And so with Strain Print, we really did need an observational study partnership so that we can gather the data from people that are willing to track their experiences with us. And we can track things like how, which cannabis products actually help with improving pelvic pain, with improving Lyme disease symptoms, with improving all sorts of things. And for us, we really did want to focus on women's health stuff because there has been a lot of research on epilepsy and PTSD, but not so much of these other issues. I mean, autoimmune disorders in cannabis, I mean, you find very little research. You find a lot of great survey studies, right? Okay, 92% of fibromyalgia patients love cannabis better than their drugs. But that doesn't really tell you what the best ratios are, or what the best products are, or terpene profiles that really are helping, or what receptors we need to hit to help that condition. And so we need to go deep dive a lot further. And because we are the only group that's focused on women's health, and we have mostly women working with us, it's been a great opportunity to really step up and be leaders, and then be able to convince the women that are not still convinced, the doctors that are still not convinced, that here you go, there's data to show that this is safe and effective. It's an alternative that you should be telling your patients about. It shouldn't be, say, the option of last resort or a dirty thing that you're not allowed to talk about in the doctor's office. So more data is good. Working with a Canadian company has some legal benefits. When the data about cannabis use is housed in Canada, it makes it much harder, say, for the US government or law enforcement to request that data to, say, try to prosecute people. And that's something that's horrible to even talk about in terms of research, but trust is a huge thing. When you're trying to recruit a patient for clinical research, they're gonna say, okay, who can look at my data? I live in Kansas. I'm talking about using, cannabis. It's not legal in my state. What could happen? And so you really have to earn the trust of the people that are working with you for clinical research. And that's one way that we can, add a layer of protection for the patients that are involved in the research. Observational research, like data mining, say a software app, is a lot cheaper than a clinical trial. It's something where we can get a lot of data points, and it's not going to cost us, say, $2 million to run a study, which is important because most nonprofits, including ours, are running in grassroots budgets and still haven't attracted, the $10 million of funding that you really need to have a operating research institute. So drawbacks of using an app like Strain Print or Medicate Me or any of these other ones is that the patients are self-reporting. And self-reporting is, like, do you remember exactly how much, that one strain reduced your headache? Are you sure you're at an 8 or is it a 7? It's very objective. And sometimes people over-report their symptom relief, especially when they're excited to be part of cannabis studies. They're like, yeah, I want to show that, cannabis is the most effective treatment for everything. So it knocked out all my pain all the time, and that may not actually be true. We also have the issue that patients that don't use cannabis don't sign up for apps about cannabis logging. And so it's really hard to say, compare a patient that is using traditional migraine treatment to a patient that is using, say, cannabis treatment, because they're not going to be logging into that platform. So really we can only compare within patients. Okay, you weren't using it before, now you are, and you're having symptom improvement. So there's some bias and drawbacks with any type of study. So that's why it's really important to evaluate, is this the best model for us, is the best software? Are there better ways we can collect this information? We also have the problem where we can't really study psilocybin or LSD on these platforms because they're not made for them. And we're missing some data points like weight and so many other things. Like when you're dealing with an outside developer, you only have certain things that they're going to put it. And then also, because we're the first American users of this app for research, we have to plug in all the products in. They have Canadian products, but we have American products that we need to plug in. So that's actually been what's been taking a little bit long with that relationship. And so we're hoping to have the study ready for enrollment next month. Okay, so second level of coaching would be community coaching. And you might see some familiar logos up there. What's nice about community coaching is it takes it out of, okay, I'm privately recording what I'm doing, so I'm now open to sharing with others and helping them through their experiences, and also learning and helping with my own travel through psychedelics from mental or physical health. And so, obviously the closest people for us to converse with are friends, family, coworkers, in-person, conversations. But then there's other ways to do this, right? You have meetings like the Psychedelic Club of Denver and other cities where you can have things like integration circles. Okay, this is what happened to me. Was a good experience. This was a bad experience. And all those things can happen with licensed therapists present or without them, but it's a great way to share. And sharing is good. But it's definitely, as I'll talk about a little bit later, has drawbacks to doing research, right? The point of these circles or groups is not often to do research. It's really to improve the health and journey of the attendees. And so there's different reasons why we share or why we work together. So community coaching is definitely probably not the best way to do research. Social networks like Facebook, there's lots of different Facebook groups out there for sharing, for cannabis. I mean, if you look on cannabis, there's cannabis for fibromyalgia, there's cannabis for everything. But some of these groups are very focused on selling things, not helping people. You also have people that think that they're scientists and share misinformation all day, and then when you try to correct them, they think that you're obviously not a real scientist because they're not a real whatever. They're masquerading on Facebook with fake profile pics and things like that. So Facebook is loaded with misinformation. It's loaded with heated people, and it's not always the best way to get coaching from other people. Other groups that are more beneficial, I mean, Arrowwood is a great group. They've been doing this for years. There's been research that's come out of there too. It's a group where you share your psychedelic experiences without your name and things like that. So there are safe places to share your experiences. It can be hard though, with too much information, what is your right path? Or for example, if you're a person with a chronic condition, right? Okay, so somebody with Lyme disease takes, say, MDMA, like these are the kind of questions people have, and sometimes they're not that easily answered in these forums. And it can be really scary. If you're on, say, 5 medications, do you know if it's safe to take something else on top of that? Sometimes it's not. And people take gambles. So we really need to go one step further than this. And I do want to point out that Third Wave is a new group that is doing like microdosing of LSD and cannabis and psilocybin courses. They're relatively new. I'm not familiar with the community, but we are having now groups that are open to, going that extra level and putting it out there like, we are telling you about LSD. That's been very different, where people have been coaching people but not being very public about it, so it's interesting to see that shift. I want to tell you a little bit about our Impact Network app, since I'm biased. We actually created it because it was really hard to provide really good science-backed information with a small amount of experts for all the people across the world that were asking us about how to use cannabis for this. How do I use cannabis for my pelvic pain? How do I use cannabis for my child's epilepsy? How do I do all these things? And really, we need to harness the power of technology to connect all these people that want information with all the experts that are sprinkled across the world. I mean, there are amazing experts in Australia, in Israel, in Canada, in the most remote countries, and they're all doing amazing work. And yet, it's really hard for us to say, okay, who's the cannabis expert in Germany? Who's the cannabis expert in South Dakota? And we have also this problem where the laws are different in every single country and state. This is also true for psychedelics. Psychedelics are legal in some countries. They're not legal in other countries. Sometimes it's legal to grow them, but not sell them or have them. It's really important that we match mentors that are experienced and say, for example, you match somebody that is a stage 4 breast cancer survivor that has successfully beaten their breast cancer, put it at least in remission with cannabis, with someone that just got diagnosed but doesn't know what the hell they're doing, right? Because matching them up with a doctor is not very useful. Some doctors really have no experience. Other people are being matched, and other platforms are talking to someone, say, from Maine about products to use for their cancer, but they live in some other state like Florida. They have none of the same products available, none of the same doctors. So it's really about matching people that are in the same city with people with the same condition that can successfully guide them through that journey. We've created a nice community. We just launched that right at the end of December. So there's some links up there. community.impactcannabis.org is where you can find the app. Right now it is free to sign on. It will not be free forever. So if you sign up right now, you will get in and you will never have to pay. So if you have experience with cannabis that you'd like to share, or you'd like to learn more about how cannabis could help you, or you don't use cannabis, but you simply think that it should be legal for every single person on this earth, please join, because it's not just about medical advice, it's also about advocacy. It's also a place where all those conversations are private. We can't see what members say to each other. So it's really, if you want to talk about other things, you want to talk about psilocybin legalization, we're okay with that. Because we know that cannabis users use many different substances. And again, tools in the toolbox. If you have a migraine sufferer and you need to use CBD and psilocybin, we support that. So clinical research via community coaching, it's a really quick and dirty way to sort of do research, but its benefits are a little bit squishy. I mean, you can mine, say, a Facebook group to figure out how people think about, say, cannabis or a specific cannabis treatment. But again, because we can't vet like who the patients are, is this a real patient with a real condition, or is this someone just bullshitting? Are these, are there 4 profiles that are the same person? These are issues we have with Facebook. We can't email people. Again, people are over-reporting, people are misreporting. A lot of times people will be saying that they're taking hemp oil and they were actually taking THC oil. They have no clue. And so if you want to do research from a group of people that it's misreporting what they're actually taking accidentally, you might get junked that in and junked that out. So it's not the greatest for coming up with, say, medical protocols or convincing anyone in the healthcare community that this works. It's all anecdotal data for research purposes. You also don't have control over the data points collected, right? People aren't putting in the brands that they're using, they're not putting their exact dosages, so you really can't find out exactly what is helping people. There are some platforms outside of, say, Facebook and in the cannabis world, like Patients Like Me, which is funded by like hundreds of millions of dollars, mostly for pharmaceutical research. 23andMe is a genetic platform that also does, a lot of pharmaceutical discovery. But these platforms charge researchers a lot of money to get data from them, or to even, say, advertise for recruiting for clinical research. So, for example, we are working with a doctor up at CSU Fort Collins that was studying cannabis and MS, and it was really hard to advertise and recruit for patients for the study because everyone either wanted a ton of money to let cannabis people try to talk to their patients, or it was just sort of illegal to say, put ads on Facebook, right? Even if you're a cannabis nonprofit, our page had been taken down about 3 times over the years, and we had to keep convincing them that we were a real nonprofit, that we were registered with the NIH, which is the National Institute of Health. Like, we went through all the steps to be not only a proper nonprofit, but also a nonprofit that does research. And yet we're still stigmatized by a lot of different platforms. So, it is hard sometimes to use social communities to do research or recruit for research. Okay, one-on-one coaching with a coach. So I told you right now, like, journaling is good, but it doesn't give you a lot of input to whether you're in the right direction. You could be slightly improving, but you could be doing it way better. When you're talking in communities, you're sharing what you're doing, but you could be sharing with a mentor that doesn't really know what they're doing either, right? So it's really, time. If you're not finding, what's working for you, say you are a migraine patient, you still can't figure out how to treat your migraines right, it's time to talk to a different kind of expert. And Infused Health, I'll just talk a little bit about this. There are different coaching sites. There's cannabis coaches out there. There's all sorts of different groups in different states. I created Infused Health because it's really important that we treat patients with serious illnesses with the respect that they deserve. It's not enough that they're like, okay, I heard about cannabis somewhere, maybe I watched a Sanjay Gupta documentary, I'm gonna go into a dispensary and find out how to treat my stage 4 cancer. Sometimes you're going to a dispensary that does have the expertise to help you, but oftentimes that's not the case. And just visiting a store to pick up your product may not end up helping you the way that you need. Some patients spend thousands of dollars on products. Some go to caregivers that may or may not know what they're doing. There's a lot of stories of cancer patients that either have felt frustrated that they've spent a lot of time and money and they're not even sure if they're going to live because they didn't find the right protocols for them, and they didn't contact the right experts. So it's really important that we pair patients that really need help, that really need understanding of interactions, say, with CBD, or the safety of psychedelic medicine with the different medications they're already on, because most Americans are on a lot of medications. I mean, people have back pain, people are on antidepressants, people are on birth control. That is a prescription medication. And psychedelic drugs can have interactions. I know that sometimes we don't want to talk about that, that every substance that you put in your body can have an unexpected response, especially when we don't understand what people's genetic backgrounds or what their medical history is. So really taking someone's medical and genetic history and prescription history and everything is so important so that we can do personalized medicine. That's what cannabinoid and psychedelic medicine is. It really is personalized medicine. We work to find out what the best dosage is and what the best options are for you. It's not just cannabis. If cannabis doesn't work for you, and there's some patients that no matter what they do, it doesn't matter what strain it is, it does not work with them. And some of these patients work better, say, with microdosing psilocybin or microdosing LSD. And so, to be able to have these conversations with desperate patients, and some of these patients are so desperate. I mean, chronic illness is terrifying. If you have to wake up every single day in horrible pain, right, and you cannot find relief, you're going to look towards anything that can help. And we want to make sure that people explore these options in a safe manner, and we can track how they're doing and optimize what they're doing. We're not just saying, okay, read this blog, go do it, and hopefully it works. And so looking at chronic pain, autoimmune disorders, which can be very complex, drug and alcohol abuse. There's many different ways to help a patient that wants to get off these substances. And from cannabis to CBD to psilocybin to ibogaine. And there's really important ways that we can help people. But we need to start doing the work, we need to start doing the research so that we can show that these things work not only in a therapist's office, but also outside a therapist's office. The important part about coaching is it's continuous care, okay? It's not just going to a doctor and then having a follow-up, say 3 months later. When you're dealing with something like weaning people off of opiates, there's a lot of mental issues that happen there, and you want to have somebody that can be on their side and dedicated and talk to them. And so we created a text messaging first platform so people can say, okay, I'm not feeling okay, or I feel sort of suicidal, like let's talk about it, let's figure out whether it's the treatment that you're on that's making you feel bad, or whether it's something else, or whether we direct you to go to the ER because it's that serious. But we need to help people through this journey that can be difficult depending on how sick they are. So to share a little bit about how this works, so patients are assigned a health coach. They're available via text message or video call. They check in with the patient, and we use tools like wireless trackers. For example, if you have an iWatch or a Fitbit, we can take data from that and add that to whatever you're self-reporting. A patient can also say, okay, I want to track, say, my monthly cycle, or I want to track how much alcohol I drink, or how much tobacco I use, and add that to the mix. In this slide, we talk about cancer prevention survivorship, and cancer survivorship is actually really interesting for psychedelic use because we don't really treat cancer survivors with the respect and care that they need. We're like, your cancer's over. But from working with groups like the Colorado Cancer Coalition, you find out that cancer survivors have long-term problems from using, say, chemotherapy or other treatments for their cancer. They end up with brain fog, they end up with depression. Some of them have a hard time returning back to work, or they have skin issues. They're also terrified of getting cancer again, and a lot of them are on drugs to try to prevent cancer recurrence. And so looking at how we can use CBD, cannabis, and other substances to improve their mental health, to improve their physical health, and to possibly even control the growth and spread of cancer so that they don't have cancer recurrence is super important. Also, tracking that data is super important, right? So many patients, once we've, say, healed their cancer, are we really following up with them? We really only hear about it when we go, okay, we have another scan and now your cancer's back. But what if we could find and validate the steps that really make the cancer go away? And again, a lot of different illnesses are intensified by stress. And the beautiful thing about psychedelics, whether you're microdosing them or using them in ways that actually improve that spiritual and mental experience, is that you can reduce stress, you can reduce baggage, you can get over that experience, that traumatic experience which chronic illness often is, or cancer is. And so just relieving that stress and breaking free can help improve your health. And I just love the mind-body aspect of all this. And so if we can actually show a patient goes and has a nice little psychedelic experience, and then we can show that months later, all these different variables are actually much more positive, we can do some amazing things. So again, the platform that we're using can look at everything from heart rate to mood to nausea to drugs consumed, sexual health, monthly cycles. So we can answer a lot of different things with this data. And the more data points you have, the more you can understand. Like right now, we take data points like, okay, not us, but other groups. We'll look at, okay, we're using LSD or we're using psilocybin for migraine and headache. but they're not taking all the other data points that could be really important. Like, okay, you microdosed and now, you know, you're having the best sex of your life, or you're sleeping better. The more data points we take, the more we'll understand about the full benefits of these drugs. So goals of clinical research, on this platform we can do research, we can do observational studies, we can do case studies because this is a HIPAA compliant platform, and so we can also have the patients input in their current medications, also track whether they're taking less of them, which often happens when you introduce cannabinoids or other psychedelics. We can also track adverse events, which is really important because there often are adverse events, but if you don't report them, you don't know that they're happening. And also we can find out how effective these substances are. It really is a numbers game. The more patients that we're tracking through this system, the better data we'll get. And this research really guides treatment protocols by healthcare professionals and patients, right? We all just want to know exactly, okay, I'm a patient with this condition, what do I do? And a lot of times we just don't have the answers. And so we're hoping with these programs, with AI and machine learning, that we're going to get closer and closer to finding out what exactly might help you. We also want this research to guide legislators on decisions on whether or not to legalize psychedelic drugs, right? And we use this even with cannabis. There are many states, like for example, I'm going to Oklahoma next month. They don't have medical marijuana and they're listening, but again, all legislators just want is more information to make informed decisions. And so if you can show them that things are safe, they can be reasonable sometimes. Sometimes, unfortunately, stigma wins no matter what. But with psilocybin legalization, we need as much data as we can in the real world, not just psilocybin from the government and clinical trial. We need to know how to, if we're talking about legalizing it for people in the real world, we need to know that use in the real world is 100% safe so that legislators can feel comfortable with this. And I've done a lot of lobbying. I mean, when they talk to scientists, they want to know, not the benefits so much, they always want to know what's the risk, what will happen if a child takes this, what happens if somebody ODs, what's the long-term issues, will people be showing up in the ERs, and so it's important to understand both the risks and benefits. Our work is really not meant on creating pharmaceuticals, but it doesn't compete with that. In many cases, from cannabis, right, I believe that there should be pharmaceutical grade cannabis, that there should be nutraceutical grade cannabis, which is sort of, where we see medical marijuana is really like nutraceutical grade because we're talking about people being able to heal themselves and dose themselves with it if they want to. And we're also talking about recreational marijuana. So I really think that those three categories also cross over to psychedelics, right? We're seeing groups like MAPS are going for a prescription psilocybin or prescription MDMA. But we should also decriminalize and allow recreational drug use. We should also allow medicinal psychedelic use, right? And maybe not require, say, a prescription for it, but allow people to explore it themselves. And then one thing to point out too is that doing these case studies or doing observational research on data that's been collected by patients that have been coached is significantly cheaper than clinical trials. And again, when we're working with minimal amounts of funding, it's really important that we get our biggest bang for the buck. And one thing I want to talk about is this new field of psychedelic coaching. I mean, we really weren't allowed to talk about this in the open, right? I mean, people weren't like, hi, I do LSD coaching, come to me on the internet. Like, that was a little scary, I think, a couple years ago. And we're seeing groups come out. Cannabis coaching is also a very, very new field, and we're starting to see groups come out, say, for example, I teach with the Holistic Cannabis Academy, I teach on women's health, and I teach on cannabis and mental health. And these academies are very new. Some of them are accredited, some of them are not. No states, to my knowledge, have official state licenses, say, for cannabinoid coaches or cannabis coaches. So it's still a very unregulated field. However, I do want to say that most health coaches are not regulated by states. So it's really up to you to do your due diligence on whether the cannabis or psychedelic coach you're talking to really knows what they're doing. Again, most of the training, right? Like you could be a newbie and say, okay, I went to this school of whatever online, and then say you're a certified coach, but you may never have coached anyone in your life. So should you go with that coach? Maybe not. So you do have to make sure that you're getting, if you want to get into this field, and it's really cool is that so many of us have experience with psychedelics and possibly even helping other people with psychedelics. Like imagine if this could be your new career. This is a really real thing. As we're talking about decriminalizing psychedelics in different states, we could have careers in psychedelic coaching. And when I talk about doing due diligence, really do look at references, look at years of training, look at sources of training, look at credentials. There's a lot of people, for example, like I have a PhD in neuroscience, I did psychedelic research, and I have been coaching people for a long time. There's other people that are like, hi, I have a PhD, I'm Dr. So-and-so, and you look at their PhD and it's like, you know, I studied sheep mating or something, and I'm not really sure sometimes if that's relevant to what they're doing. And you know, you don't want to hurt people's egos, but you also want to protect patients and really ask, okay, do you have any medical background whatsoever? Like I went to therapist training, I worked with neurologists and psychiatrists. My department was actually molecular psychiatry, and so, you know, what I was doing was very applicable to what I'm doing now, even though most of the research I was doing when I was working out my PhD and afterwards was with animals. But I was trained on how all these different drugs worked in the brain. So you really have to make sure that your coach knows what they're doing. And there's a lot of fake people out there, just like there's a lot of like snake oil, CBD companies and things like that. So you really have to be careful about who you're working with. And psychedelic coaching, again, is brand spanking new. So we have still yet to see, besides, say, the researchers that have been doing this before, you know, even before 1970 when LSD and other psychedelics were made illegal, like there's some like, you know, grandfathers of research that have been doing coaching and research, you know, sometimes quietly, sometimes almost like illegal research over the years, but they know what they're doing. Somebody, again, like you have to make sure that you're getting the quality of education and support that you need. Okay, so this is the part where I talk about the one-on-one coaching with licensed therapists. This is actually where people see the most benefits of psychedelics, and it's where most of the published research has actually been. So I have to give the credit to MAPS, the Multidisciplinary Association for Psychedelic Studies. Rick Doblin is amazing. He founded that organization, I believe, in 1986. I was 4 years old then, so do not have the experience of Rick and will never claim to, but he has done an amazing work in funding psychedelic research and psychedelic support programs from everything from like Zendo Project. But what's really cool is that we're getting closer and closer to seeing psychedelics actually become prescription drugs, right? And there have been some research studies. MAPS has really been very close to recruiting for phase 3 trials. They actually have a center up in Fort Collins where they have MDMA trained therapists. And basically you go in the office, you have MDMA sessions, and I've actually been to, say, one of the psychedelic dinners. I went over in Atlanta and heard from a veteran that had gone through the MDMA study, and it's so powerful to see people that have struggled and have been suicidal or have been addicted to substances of abuse, depressed, you know, hurting their family, hurting others, hurting themselves, go through these therapy sessions and come out a new person. Not only come out not depressed, not wanting to kill themselves, but also with renewed purpose, like, oh, I want to do this with my life now. And so knowing that, you know, we have so many veterans killing themselves every single day, this option really needs to be available as a prescription drug, because the VA is not a fan, unfortunately, of say, using Schedule I drugs. They're very much will allow Marinol to be prescribed, but not so much cannabis. So for that setting, it's really important that our veterans do have access to a prescription drug. And it looks like on the MDMA track that about 2021 is when they expect to be able to see that become a prescription drug, which would be amazing. Because again, people need access to this, especially if they're at risk of dying. LSD, there's also been studies with LSD and end of life, and it's sort of interesting because it's very similar to cannabis. Like the initial cannabis studies were all about like terminal patients and people that are seriously ill and that need this. And so with LSD, we also had, looking at people, coming to terms with dying, and they had some really positive effects with this. But it's sort of interesting because the clinical work, again, is at end of life. And we do know that LSD has the ability to help so many people at different stages and different conditions, right? Like, let's not wait for end of life. Let's work, with somebody that is struggling with addiction or is struggling with headaches or struggling with all sorts of different things. So, but that was an amazing study. Psilocybin, there's also been psilocybin studies funded or supported by MAPS. One is, again, a cancer study done with NYU where they gave them psilocybin in therapist offices, and they were able to deal with the fact that they were going to die and be very, very positive about it. And all of them saw these psychedelic experiences as something very powerful and positive in their life. No one saw it as something that amplified their fear of moving on. And so it's really important that we always think about enhancing people's ability to move on with dignity and sort of break away from the fear of dying, which I think the American culture really supports us not wanting to let go. And for those patients, it is really amazing. There's also psilocybin facilitated addiction treatment. So again, we're dealing with an opioid crisis. So if we can help people stop and break their addiction to heroin and other opioids, we can do some amazing work. Ibogaine is actually a really interesting psychedelic. It's not really one that you find in the United States. There's clinics in Mexico and other countries. It's considered a dangerous psychedelic because about 1 in 300 people actually die through that experience. It may be because it's unsupervised. It may be because we just don't know enough to practice it safely. But there have been 2 published studies looking at addiction and ibogaine use, and it is helpful for the people that use it. I mean, I met people that have gone to these clinics and their lives are changed. To have somebody that's been struggling with substance abuse for say 20 years, goes to an ibogaine center and never does a drug again is just phenomenal. So it's really cool that MAPS has done these studies, really powerful. There's also, I don't think I put in the slide for this, but Dr. Sue Sisley is sponsored by MAPS, and that's the cannabis study with veterans with PTSD, and that was actually the very first FDA-approved clinical research study looking at cannabis, and it is still recruiting, and so going through it, but it's very interesting because at the end of the study, it's possible that cannabis gets introduced as a new drug for prescription treatment. So MAPS has done incredible work, but MAPS and other groups do very much support that psychedelics should be used in the therapist's office. And there's all sorts of different discussion here, and I'm open to thinking and hearing about what everyone here feels is appropriate. I mean, I think for some really deep work, and when we're talking about people on the brink of death, say with opioid addiction, I think that working with therapist offices in a therapist setting is really important to do that hard work with people that, again, may be very unhealthy. But for, say, someone that is simply trying to microdose to manage migraines might not need to happen in a therapist's office. So there's all different ways that we can approach these health issues, and let's talk about what the goals of MAPS. So they're doing these FDA clinical trials which are very expensive, with the goal to get these substances approved as a new prescription drug. And they did found MAPS Public Benefit Corporation, which is a group that can produce these new approved prescription drugs. For example, they're working on MDMA, so they would be the MDMA production facility. And so, being an ethical, say, a pharmaceutical company is something that we don't really hear of in the United States. Most pharmaceutical companies like to jack prices up and make drugs unavailable. So hopefully, if MAPS has control of these substances, that they would be able to offer them to veterans, to people that really need them, at prices that are affordable. The one thing to note is that this doesn't legalize MDMA for the rest of us. So for example, if you're at a festival and you have MDMA, you're still gonna get in trouble if you meet the cops, right? For somebody that says, is microdosing MDMA for some reason, whether it's to treat, there's some evidence that it helps certain autoimmune disorders, whether that's healthy or not is still debated. But legalizing psychedelics to become prescriptions does not legalize possession for everyone. And these studies are really expensive. I mean, MAPS has been constantly raising money. I do want to give them kudos. They got some funding from Pineapple Fund, which is the Bitcoin group. So they got like millions of dollars in funds and matching funds. And they're still, I believe, they are still matching. So if you do want to donate to clinical research on psychedelics, go to MAPS, donate, and your donation will be matched by the Pineapple Fund, which is the mysterious Bitcoin donor that is nameless but has a heart of gold. So, okay, and this is where I do want to point out that it is so important for us to do things like decriminalize psilocybin and decriminalize other drugs, because legalizing prescription THC or Marinol didn't legalize cannabis. And we're going to look at this road where it took so long for us to get to the point where we were thinking about legalizing cannabis at the federal level. I mean, 1970, cannabis and all the other psychedelic drugs were made illegal because of the Controlled Substance Act, or CSA. So Schedule I is no medical benefits, highly addictive, can't study it, so it's a catch-22. You can never actually give them the evidence to show them that it shouldn't be descheduled. And in fact, to my knowledge, no drug has ever been rescheduled. No drug. There are some drugs that they're thinking about possibly moving from lower schedules to higher schedules, but no drug has ever gone to a less dangerous schedule. So to think that we can do this in the United States with cannabis is a little harder. Decriminalization and removal off the schedule would be the ideal. But again, we have a long ways to go. In 1985, Marinol was approved, and that's synthetic THC. It doesn't have any of the other cannabinoids or terpenes that are available in the plant, so it's not whole plant medicine. It is used to improve appetite. It is prescribed in the VA system for patients that can't use cannabis because they'll be kicked out of the VA system. But most patients don't like it because it has a lot more side effects and a weird profile compared to normal cannabis. It took 11 years to institute a medical marijuana program in the United States and a dispensary system. And I want to give pause here because Prop 215 was what legalized medical marijuana in California and created all these opportunities like legalization here in Colorado. And I want to give it a second to remember Dennis Perrone, who just recently died and was the co-author of that law. So amazing man, I got to meet him, so thank you, Dennis Perrone, for opening this up. In 2014, we had recreational marijuana dispensaries open here in Colorado. We were the first, and remember that. We are free thinkers, we are free people, and we can get things done. So that's an inspiration for our psychedelic initiatives here, because people go, oh, it's California, it's Oregon. You know what, in Colorado, we get it done. So we're open and ready. Thank you. In 2018, here we are, and unfortunately, we're in a Trump administration world, so legalizing cannabis on the federal level, probably not gonna happen this year. I mean, like, we're trying, but, you know, we have so many bills from the Marijuana Justice Act, to the CARES Act, to this act. I mean, it's almost overwhelming where you're like, okay, we have like 50 different acts, just pick one of them and like, let's go. But there's a lot of hurdles in place, and having an attorney general like Jeff Sessions, who's against medical marijuana in all forms and cannot be educated, is just depressing, and it's one of those things where we may have to wait, you know, until the next president to work on this. And unfortunately, that means that there's no federal funding for medical benefits research. There's only one legal source still for cannabis research at the universities. They will not, and this also pertains to CBD. They'll allow researchers to get CBD, say from GW, but they won't let you use brands in a clinical trial that come from Colorado. So it's freaking frustrating. Other countries like Canada, which have legalized cannabis on the federal level, can do research so much more easily. Israel, Australia, I got an offer the other day to do any study I want in Australia, but like was told basically to give up in the United States, and I'm sort of frustrated enough to be like, okay. But you know, 2 years later, this may be a very different plane. Okay, psilocybin legalization. So there's 3 efforts right now, and I'm sure there's other ones that are in talk in other states now that we are having these conversations across the United States and bringing up courage like, hey, your state may be open to this. Let's figure this out. Whether this happens in 2018, whether it happens in 2020, 2025. I actually would like to see psilocybin legalization happen before psilocybin or other psychedelics get legalized as a prescription drug, because again, we know from the Marinol story that when you get things scheduled, like Schedule 3, right? Imagine if we get CBD as Schedule 3, like does that bode well for CBD and hemp oil makers in the United States? Not so much, like it's a little scary. That might actually happen at the end of this year. So it's important that we get psilocybin decriminalized, or we put in systems in place that are similar to, say, our cannabis system, where we have seed to sale tracking, at least for our very conservative legislators that are worried about unleashing psychedelics into the world. But in California, there's an initiative right now that they're gathering signatures for by Kevin Saunders. The website is up there. We also have an initiative in Oregon, which I thought was going to be, they were going to put in place in 2018. It looks like they're working on it more for 2020 because it's a very complicated system that also uses the therapist model where psilocybin can be used in the therapist's office. And then we have our own very Denver initiative. And what's interesting about this, it wasn't so much Colorado initiative, and there are reasons for this. When you do an initiative in Colorado, you have to gather, you know, hundreds of thousands of signatures, and that can take time. That also requires money and funding that is sometimes really difficult to get. And so looking at trying to, say, institute an initiative for 2018 or a year or two later, like, it's much easier to do a city-based initiative. So if there's anyone here that from the Denver Psilocybin Research and Remedy Exemption Initiative, if you can stand up and wave to everyone. Hey. Yes. Yay! I want to give a big thank you to Teresa Egbert, who was one of the first people to talk about putting this in. And the Denver Psychedelic Club has also been very helpful in trying to write this up. So there are so many things that need to happen with an initiative like this. You need signature gatherers. You need donations to be able to make this happen, to be able to put the time in the lobby, put in the time in to educate the public. So this is definitely something that is in its baby stage. There's a new Facebook page that just got put up. Of course, there'll be a website that'll be in place pretty soon. We're going to work on this as a community, and hopefully, because Denver requires less signatures than, say, a state initiative, there's actually a shot that we could get this through. So that's exciting, and I support all these initiatives. Again, we need all drugs decriminalized in all states. So very proud of the work that's being done here in Denver. And again, sitting in this psychedelic church, I mean, like, imagine if we had psilocybin legal. Oh my goodness, oh my goodness. I'll take a journey with you guys. Okay, so lessons from cannabis legalization. This is an important one. This is a slide that I spoke on at the Telluride Mushroom Festival and all the other mushroom talks that I give. Both psilocybin and cannabis are still Schedule I drugs, so we can't research them very well. DEA Schedule I licenses are required for researchers that do obtain the drug from the government, and there's a lot of stigma for researchers. I mean, myself, other researchers think I'm a drug dealer. Like, literally, I'm a drug dealer. My PhD mentor was just like, get away from me, drug dealer, and called security on me. I was just like, this is happening? Okay, I'm gonna go now. I'm just talking about cannabis for like other diseases besides epilepsy. So many researchers that support this are afraid to come out of the closet. I actually formed a group called Scientists for Legalization, which is a group of scientists that not all of them want to come out publicly, but you know, if we get enough of them together, we might march on Washington or do something crazy, you know. Maybe if we slip them some psilocybin, they'll realize, you know, that this is their purpose and to get going, you know. So what's really important about cannabis legalization is those lessons. We need to educate patients. We need to educate nonprofits. I mean, talking to groups like, you know, migraine headache nonprofits or, you know, NAMI or some of these other mental health groups, educating them on what the potential is of psychedelics for therapeutic use is really important. Educating your policymakers, you know, it's time to get active. You know, if we put this bill in, we need to talk to our senators and representatives and let them know how we feel. We also want people know that we are psilocybin users. Guess what? We're all in the closet. I'm pretty sure that taking a picture of yourself saying, hey, I use psilocybin for my headaches, you're probably not going to get a visit from the Denver police. So we have a pretty open, you know, group here, especially because, you know, it's basically cannabis or psilocybin use was not, you know, not their biggest worry here. We definitely have a lot of opiate addicts and other people that are struggling. Boulder, of course, is a very open place. I would say that probably waving your psilocybin flag in, say, a very conservative county, or like, say, Pueblo, may not be the best idea. But we need to start coming out of the closet as psychedelic users. We need to reduce stigma through media campaigns. And one of the media campaigns I really want to talk about, I'm excited about, was the My Health Freedom campaign. And my dear friend Felicia Carbajal out in Los Angeles started this campaign based off of the No Hate campaign, which I'm not sure if you're familiar, was when they had the tape over their mouths and they wrote no hate on their cheeks, and they took pictures of people that supported same-sex marriage. And those kind of visual campaigns let people know and feel like, okay, you know, this is my friend, this is, you know, a cop next door, like, we're all supporting these things, so it's okay to support this. And after the No Hate campaign was launched, we did actually see at the federal level, the Supreme Court level, that same-sex marriage was legalized. So she did the same campaign with cannabis, and it was, I support cannabis because, or I'm a medical patient and this helps me, or I'm an ally of cannabis patients. And it was a simple campaign with signs. People print out a sign, write something on it, take a picture, and as you can see there, there's, you know, hundreds and thousands of patients all across the United States and in other countries like Mexico where they've collected these pictures. And there's been people from Impact Network events and other groups that have participated. And I really think that what's important is that we start that same campaign with psilocybin. Okay, if we start telling people that it helps our migraines, that it helps our PTSD, that it saved our lives, people are gonna start seeing us not as drug addicts or, you know, like fun seekers. It is medical, and it's okay. If you had a one-time experience and, you know, at a festival and it changed your life and you're now like a successful, you know, business owner, whatever it is, whatever your story is, share it. Because people aren't hearing those stories. The public is not going on forums to figure out what your experience is. You need to come out of the closet, and it's a hard thing, but eventually, if a lot of us do that, there's strength in numbers, and the public starts to see us as people. And then also, the last point I want to put out there is the private fundraising for research. There's been a ton of cannabis studies. There have not been tons and tons of psychedelic studies or psilocybin studies, so it's really time for us to get together, make registries, put safety data out there so that we can, again, educate the public. If they're going like, well, what happens? I heard that if you take LSD, you have flashbacks for the rest of your life and you're a mess. So you're like, that's not true. In fact, let's show what this real research is. In fact, did you know 1,000 people in Denver microdose every day, and this is how they're benefiting? The numbers, the data doesn't lie, and the data convinces. So research is important. Okay, so this is the part where we have a beautiful church. We have this beautiful audience of people that came out on a Monday. Hell yeah. Okay, so great leaders don't create followers, they create other leaders. And I want to inspire each and every one of you to be a leader. And the United States needs you, patients need you, basically the world needs you, because if we can legalize psilocybin here, it'll be a domino effect. We'll start legalizing across the United States and the world. So how you can get involved, you can support organizations like MAPS, like Impact Network, like these psilocybin legalization initiatives. You can get signatures. All these initiatives, whether they're in Colorado or California, need people to go out there and get the signatures so that they can get these bills on the ballot. And it's no easy task, right? And it takes a long time. You actually physically be out there. You have to collect signatures, but it can happen. For example, it was a Denver ballot initiative that got social consumption passed. It was like so close. It was like 51% or something to 49%. Like it barely passed, I think, in Denver, but it passed. And it took the work of a lot of hard-working volunteers to get that done. So if you want psilocybin legal in Denver, you got to work for it. So if all of us pitch in just a little bit or a hell of a lot, we can get this done. So remember that. Show up, because it's not enough to just say I want it and to sit on the couch. You got to go. You got to earn it. Support on social media. We all have these Facebook groups, pages, Twitters, whatever. You find something, whether it's news about psychedelic research or an event, we can grow this, right? Like there are so many amazing people here, but like I'm sure that there's more people in Denver that support this. So let's grow our amazing groups like the Denver Psychedelic Club. Let's grow MAP supporters. Let's grow our psychedelic community to be unified to the point where we're like, we're not a minority, we're the majority. So we can only get bigger from here. So share, spread the word, participate. Volunteer, again, if you can't get, signatures, I know some of us have invisible illnesses and we can't stand up all day, chasing people to sign petitions or to sign, ballot initiatives, but we can work in other ways. You can help with social media, you can help with email marketing, you can help, at an event, so volunteer. Also volunteer for clinical research. MAPS is recruiting volunteers right now. They have a study site in Fort Collins, so go volunteer. We'll be opening up our studies, so come find us, and we'd love you to work with us. Get coached, whether that means doing your journal, whether that means opening up an app and tracking your own work, whether that means working one-on-one, but if you provide the data, you're another data point that gets us closer to validating that these medicines out in the real world are helpful and should be legalized. Finally, learn. Keep learning. I mean, it's amazing. The internet is so freaking amazing. There are conferences that are filmed just like this. I can't wait for more people that didn't have the opportunity to be here in Denver or be here tonight to be able to learn about the possibilities that are here. There's great researchers that are presenting all the time. I know we don't have the money to say fly to different states or countries to hear about their work. A lot of them are filming and providing those talks for free. So educate yourself, because when you know, you can tell somebody else, and they can tell somebody else, and you'll never know who you could help. So just keep learning, get involved, and we can rock this thing. So I want to thank you so much for listening to me go on and on and on.
Hey guys, I just want to introduce myself really quickly. My name is Steve Burke. I'm one of the co-founders here at the International Church of Cannabis. Everyone give yourself a round of applause for making it out tonight. For those of you that don't know what the International Church of Cannabis is, we're a church and we have services every Friday evening. So we do something similar to this. It's not always about this subject matter, but we bring in different guest speakers week by week. You're allowed to bring your own cannabis into the church and consume during services. So it looks just like this, except everyone's lighting joints. It's pretty awesome. It's pretty awesome. We have different speakers and a different band that plays every single Friday night. Our doors open at 6 o'clock, and services begin around 6:30 p.m. After our services, we have a big potluck, so everybody gets fed. We do it every Friday night without fail. You can bring it over to the church. The only caveat is you have to be a member. And the only way to become a member, go on our website, internationalchurchofcannabis.com. You can apply to be a member right there. There's no cost for membership right now, but Bertie told me that after 420 this year, there might be a cost. So sign up now, become a member now. Come and join us on Friday evenings. It's a whole lot of fun. Thank you guys for coming. That's my announcement.
I started microdosing mushrooms this morning. What is the best way I can help you to complete your mission?
Okay, so again, journaling, you can journal right now, or you can go to infused.health. We can enroll you in our program so that we can actually get some more specific data points, like how it's affecting your heart rate, how it's affecting your mood, how it's affecting all these things. And those are really easy readouts. They're basically things that can be plugged in through Apple Health Kit through your smartphone. So we would love to learn more about how that's helping you. So definitely go to our website and shoot us on our contact form.
You said there was some restricting from taking CBD with other medicine. Could you speak to that a little bit real quickly?
Sure. So CBD can inhibit P450 liver enzymes, some of the subtypes. So there are some drugs that it doesn't impact at all, and there are some drugs that it is a little less than safe to work with. There's specifically an anti-seizure drug. There's some antipsychotics. Warfarin is a blood thinner, which actually a lot of older people are on, that can be problematic. And then there's something that I actually found out not too long ago. So CBD doesn't inhibit the breakdown of, say, psilocybin because it doesn't go through the P450 system, but when it gets converted to psilocin does get metabolized partly from the P450 system, so there should be maybe some things that we should learn about with people that are taking both CBD and psilocybin at the same time, because it may be as simple as they need to use less psilocybin because the CBD is making it the psilocin more active, and psilocin is the active component of magic mushrooms, not the psilocybin. So there's just a lot of things that we don't quite know yet, and it really is helpful if you are on a lot of medications or you are taking multiple substances at the same time to understand whether that's the best thing for you.
Thank you very much for this. Perhaps I missed it, I didn't hear you mention anything about Soviet norms. Is there reasons for that?
So Sofkit is actually not a scheduled drug. There is some research on it. I'm not as familiar, so of course, you can't be an expert in everything, so I definitely don't give talks on things that I don't know a lot about personally, or I've never tried it. I don't know too many people personally that I've shared, those experiences of hearing about them use it. So I'm a newbie in that area. So if you'd love to educate me, I would love to learn more.
One, I was wondering if you could talk a little bit about CBD. I read in my CBD 5-HT1A agonist, which a bunch of newer class of anxiolytic drugs target. So if you know about that, and also its action at any of the opioid receptors, I heard is a positive allosteric modulator. Somehow it doesn't bind like the normal opioids.
It's really interesting that, when we talk about safety of CBD, a lot of people just think that it works by elevating, say, anandamide, right, that binds to your CB1 and CB2 receptors. But CBD is a ridiculously dirty drug. As you said, it binds to serotonin receptors. It can bind to opioid receptors. It can even bind to specific subtypes of dopamine D2 receptors, which actually may be how it works to relieve symptoms of schizophrenia at very high doses. There's still so much that we don't know exactly because animal studies sometimes are not super reflective of what happens in humans. And in case, I will say this, is like rodent research, right? We actually found out that CBD works by binding different proteins in the rat than they do in the human, and then there's different also transcripts of CB2 receptors, so there's still so much that we don't know. The opioid thing is very interesting. Obviously, it has meaning when we talk about using CBD to help people get off of opioids, but that field is very new. Most of that work with CBD and opioid addiction has been done by Yasmin Hurd, Dr. Yasmin Hurd at Mount Sinai. So there's still so much, I can't even answer about this. There are more receptor targets too from GPR55. We just don't know how these drugs are working individually and how they were working, combined. Because if it's working on a 5-HT receptor, it's increasing anandamide at the CB1 and CB2 receptors. It's working on these orphan receptors. It's working at the opioid receptor. I mean, it's amazing because it's having all these beneficial effects, and that's why, sometimes we can talk about CBD being useful for almost everything, which sounds like a snake oil thing, but it's also scary when you don't want, say, an effect at a serotonin receptor. You don't want an effect at an opioid receptor. So, being a drug that operates a little bit on everything can be a little bit scary for a pharmacologist or a scientist or a healthcare professional. So I don't know the answers to everything. So. Sure. So for a lot of people, right, we have a lot of nutritional deficiencies, and there are some things that are missing from our diet that could preclude us from having the building blocks of, say, anandamide, right? And so if you don't, hello. Hey, that was very ominous. There's the potential to actually make sure that when you're taking, say, CBD or you're taking another substances that might elevate your anandamide, that if you have a nutritional deficiency, you may not be able to actually benefit from taking CBD, right? And it's just like, when you take a drug that, say, boosts serotonin release or dopamine release, but you don't have enough serotonin to begin with, right, because you don't have the building blocks, it's useless. And so why would drugs that target the endocannabinoid system be any different? So for a healthy brain, in many ways, having a high level of omega-3s is helpful. But unfortunately, the American diet is that we have a ton of omega-6s from our really crappy, just fast food, meat-heavy diet. So we'll learn how omega-3s, supplementation, and CBD really interact to be very helpful for mental health illnesses and other conditions, but there is minimal research on that at best.
Thank you so much. I appreciate so many points you made this evening. Thank you to the Church of Cannabis. This is a beautiful space you've created. I appreciate that you mentioned the Me Too movement earlier in your talk, and thanks for recognizing that. So often when we think of PTSD, we think of military veterans, and there's certainly plenty of them, but among people suffering from sexual assault, PTSD is even higher. And a friend of mine works with people with disabilities, and apparently they have an even higher rate. So there's a lot of healing to be done, and I agree there's a lot of potential here. I noticed recently on Facebook, and that's a huge tool, it's a mixed bag for sure,
Yep.
but very useful. And part of the reason why I'm here is because of hearing about it through Facebook. Recently I've been getting a notice from Facebook about, I think on HBO, there's a new program called High Maintenance, and it's very much connected to these issues. And again, we're overcoming the reefer madness portrayals of these substances and high maintenance. I think it's HBO, maybe Netflix, I'm not sure, but there's a lot of cultural, creative stuff going on that's helpful for the movement. And I'm wondering, what are you saying? What music or movies or programs, pop culture you're saying that you think is helping the evolution along?
Well, I do think that channels, say for Vice, which is also a mixed bag, sometimes they put out crazy things, and sometimes they put out very relevant and educational things. So like Hamilton's Pharmacopoeia, for example, is a series that focuses on different types of drugs, and I've watched most of the episodes from ketamine, peyote, like to all these different drugs that people don't really see, and I think that series in particular is very thoughtful. But I do think that cannabis legalization has had a big impact on why we're having these discussions about the other psychedelics, and it's funny because most conservative people, their response to why they didn't want cannabis legalized was because, well, it's cannabis first, and next it's magic mushrooms and cocaine and this and that, and it's one thing to say, okay, this is right, but this one isn't right. When we talk about decriminalization, we do have to think about all drugs because it's treatment and harm reduction that we should be looking at, and not judgment on why people use substances. Every single person in this world has pretty much used a substance at some point or the other. Maybe something as simple as caffeine, it could be a psychoactive substance like melatonin, but we are all drug users. And it's time to get over stigma, and it's time to start exploring. There's been amazing documentaries on so many different types of drugs. So, thankfully, pop culture is catching up with the need to be an advocate. Okay.
Real briefly, you mentioned about using it for addiction treatment. I know they had it with Ibogaine over in New Mexico and whatnot. What other psychedelics are they used to treat addiction, and what other research are they doing to do that, or move forward with that? Sorry.
Sure. So psilocybin has, there was a study on it for nicotine addiction, which again is probably like a softer addiction, but is still something that's associated with lung cancer and something that is very, very hard to quit. CBD in particular, there's clinical research, as I talked about with Dr. Yasmin Hurd, on treating heroin addiction and other opioid addiction. CBD has also been used for methamphetamine, cocaine, alcohol. I differ in some other drug addiction researchers in saying that I believe that THC needs to be in the mix as well, because we, in our own coaching, in my work, I found that CBD is not enough in humans really to get them through long-term withdrawal issues. Really, THC, if available, combined with CBD is really powerful. And we really think that long-term maintenance of people that have been addicted to drugs for a very long time, you're going to need both substances to help. And you're going to have a speedier recovery. But a lot of addiction researchers, like for example, Dr. Yasmin Hurd, thinks that THC is harmful, right? And or dangerous, or it's not okay to replace another addictive drug to substitute, a more more dangerous drug. But when we look at harm reduction, we look at addiction treatment. I mean, for heroin users, we put them on Suboxone, we put them on these other drugs, which are other opioid drugs. And so substitution therapy is actually like the basis of most addiction therapy. So substituting people on different, much more dangerous and lethal substances and moving them onto a replacement therapy, say with Cannabis for Life, I don't think is really replacing their addiction or feeding their addiction. There are some people that don't respond appropriately and they still have problems going back to work and going back to their regular life because they have some abuse of cannabis, but that's very low. Most people that have successfully worked with coaches and doctors to get off of opiates with cannabis have amazing success rates. And in fact, there's actually a clinic down in Colorado Springs that has like a 70% success rate with treating heroin addicts. So if anyone has any interest in that, I can refer you. There are amazing people working all across the United States and the world on this. And I think, again, it is a tragedy that we don't allow cannabis use in most rehab centers, that we don't have rehab centers that are dedicated to treating people only with cannabis. There are some in Maine, for example, an amazing woman that I've worked with and visited her facility. She has a rehab center for women that treats only with cannabis and kratom. And then she teaches them how to grow their own cannabis plant so that they can afford for the rest of their life to be able to produce that plant so that they can take their medicine and not be dependent, say, on a dispensary where they may not be able to afford the medicine. So much work is being done, so much work, so much potential. I used to do drug addiction research. I found it very disheartening because all the different things that you can pump through these animals that are synthetics were never as good as what we're seeing with cannabinoids. And there's so many different reasons why you're going to decrease inflammation in the brain, you're going to grow new brain cells, you're going to activate the dopamine system. There's so many different reasons why cannabinoids work and why other psychedelics work for addiction. We're still understanding the processes behind that. But I think the most important thing that I can tell you is that we have to be worried about when we take the magic out of some of these magic substances. There are pharmaceutical companies that work to produce entheogens without the psychoactive part. And I really think for addiction, you absolutely have to have that emotional and spiritual healing to move on with your life. Simply taking a pill and suppressing, say, craving for drugs is not going to do it. You have to connect with the reason and the pain and the trauma, why you became addicted in the first place, and heal that so that you can have, and maintain the life that you want to live. So don't take the magic out of any of these psychedelics. We need those experiences to truly help these patients. So. Hey.
Thank you guys so much for coming tonight. I just got a couple announcements. So the next meeting for the psilocybin initiative is going to be this Wednesday. They're working on legislation to pass it. We're meeting at Pride Rock. It's 1223 21st Street from 4:20 to 7:10. Find it on Facebook. We also are selling LR test kits downstairs. They're used to test LSD, DMT, psilocybin. They cost $20. They're good for 50, 60 uses. I feel like if you use them once and it's not LSD, you've already paid for it. So come grab one downstairs on your way out. And the last thing I have to say is our weekly meetings are every Monday at 7:30. We meet at a coffee shop called Hooked on Colfax. Come check us out. We have a movie night our next Monday. We have all sorts of different stuff. We have a psychedelic integration circle. We sometimes get smaller speakers, and we do a lot of community discourse. Thank you guys so much for coming.
Oops. And I just want to add one side note for research. It really helps us if you know what substance you're ingesting. So if you have a test strip and you can validate that your product is unadulterated, that helps us out immensely. So thank you.
Thank you, everybody, and have a great one tonight.
Thank you.